I'm Peggy Peck, MedPage Today, at the American Society of Clinical Oncology meeting in Chicago. Endometrial cancer has a high recurrence rate, specifically recurrence in the vagina. A study reported here suggests that vaginal brachytherapy, rather than external beam radiation, may in fact be a better way to treat and reduce the rate of recurrence.
In this trial, we randomized between pelvic external beam radiotherapy versus no additional therapy. And for patients with high intermediate risk endometrial cancer, we found out that they have approximately 20% risk of developing a local regional recurrence if they receive no further treatment after surgery. And that means that approximately 1 in 5 patients is at risk for developing a local regional recurrence. And of these local regional recurrence, approximately 3/4 are located in the vagina. And that's why vaginal brachytherapy, which is short-range intravaginal radiotherapy, is an interesting option in this patient population. So with external beam radiotherapy, we saw that we could reduce this local regional recurrence risk from about 20% to 5%. And this did not lead to a survival benefit, and it was associated with mild gastrointestinal toxicity. So that's why we wanted to look at the role of vaginal brachytherapy in this patient population. So pelvic external beam radiotherapy was given in 23 fractions of 2 grays, so it took approximately 5 weeks to complete the treatment. And vaginal brachytherapy is either 1 fraction low-dose rate brachytherapy or 3 fractions of 7 grays high-dose rate brachytherapy. And this can be done in an outpatient basis. So our primary endpoint is vaginal relapse rate. Secondary endpoints are quality of life and survival. So we now have a median follow-up of 3 years. And as you can see, we have very few vaginal recurrences. In each treatment arm, there are 3 patients in total, and the recurrence rates at 3 years were 1.9 or 2% in the external beam radiotherapy group and 1% after 3 years in the vaginal brachytherapy group. And actually, the 2% is very similar to what we expected based on our first PORTEC trial. And the 1% actually proves that vaginal brachytherapy is really very effective in preventing vaginal recurrences in this patient population. So we also looked at pelvic lymph node recurrences, and we saw a slightly but significantly higher rate of pelvic lymph node recurrences after brachytherapy. However, the rate at 3 years was very low with 3.5%. And more important, if we look at local regional recurrence, which is a combination of vaginal and pelvic recurrence, this did not differ significantly. And the most important finding was that patients treated with external beam radiotherapy reported significantly and clinically relevant higher levels of diarrhea after start of radiotherapy. And although these rates decreased, they remained significantly increased compared to brachytherapy. And more important, we were able to ask the question if patients' daily activities were limited because of their bowel problems. And again, patients treated with external beam radiotherapy reported increased limitations by bowel problems after radiotherapy, and this difference remained with further follow-up. So our conclusions are that vaginal brachytherapy is a very safe and effective treatment for patients with high intermediate risk features. And as we saw, there is less treatment-related toxicity and a better quality of life compared to external beam radiotherapy. So we pose that vaginal brachytherapy should be the treatment of choice for patients with high intermediate risk.
So to sum up, based on this trial, vaginal brachytherapy may in fact be a better option than external beam radiation therapy. At ASCO, I'm Peggy Peck, MedPage Today.